Hi, I'm Dr. Ruling, welcoming you to another Total Health seminar. This one entitled Awaken the Doctor Within You. We need to listen to body signals and not take drugs that override those signals. Can you guess the most overlooked cause of medical problems in the world today? A drug that millions use daily without thinking of its effects on the body? Yep, it's one of those brown liquids. Let's look at the effects of caffeine on the body. First of all, the nervous system. Caffeine whips the nerves. It allows us to work when we really need rest. Caffeine can be an addiction, and it causes insomnia and other problems of addiction. Instead of quitting caffeine, some people buy over-the-counter drugs or a prescription. The drugs tried in this bad habit cycle include Nitol, Sominex over-the-counter, Restoril, Vistaril. But some of these are prescription items: Halcion, Ambien, Xanax, very habit-forming, actually addicting. Yeah, I worked in a pain clinic one week, relieving a doctor who was gone, and half the people walking in the door wanted Xanax. Addiction to tranquilizers. Most patients are addicted to Xanax, Valium, Valium, Ativan, would not have needed these drugs if they had never used caffeine. Does our day begin with a brown liquid? If so, you may have been whipping your body until your get up and go has got up and went. It's called bad habit glue by Dr. Pavlov, Russian scientist, who saw that it glued the bad habits together. People eat poorly, get little exercise, watch TV too late, and would never make it up in the morning to get to work unless they had the caffeine. It works in a deceptive way, giving us a lift, as you can see here, but there's always a letdown afterwards, leaving us a little lower than we were before we ever drank the coffee. And the same way with, so people go through their day like this until they're really worn out. Caffeine can cause headaches. It's in drugs like Excedrin and Anacin, and that's why those prescriptions sell well. They help eliminate the withdrawal headaches. When people are busy and they haven't had their usual coffee, they may get a headache, and the over-the-counter Excedrin or Anacin does them by giving them a caffeine fix. It can cause osteoporosis. The more regular coffee a woman drinks, the more calcium is excreted in her urine, according to this Washington State study. Or you can take Boniva, more drugs. Not good. The loss of amount of calcium is 5 milligrams for every 6 ounces of coffee or 2 cans of cola, according to this study in the University of Nebraska. 100 milligrams of caffeine daily increase the risk of miscarriage. The risk of is proportionate to the amount of caffeine that one drinks. That was the New England Journal of Medicine, very good medical journal. And chromosomal damage, like cleft palate and hair lip. We've all seen pictures of some little child with a deformed mouth, and they are appealing to you for surgery. Well, why don't they just tell people, hey, cut the caffeine, it causes the birth defect. The risk of bladder cancer is higher in women who drank 2 or more cups a day. Caffeine alters body chemistry. It increases triglycerides and free fatty acids, also the blood sugar, and blocks phosphodiesterase, making the responses overreactive so that people can do that. Cutting caffeine may help control diabetes. Duke University researchers found that caffeine exaggerated the rise of glucose after meals by 9% after breakfast, 15% after lunch, and 26% after dinner. That was reported about nearly 10 years ago. The decrease in insulin sensitivity may be due to a 5-fold increase in adrenaline, because we get excited, and that's what's stimulating the insulin insensitivity. Blood pressure can go up also because caffeine makes the heart go faster. Does your heart skip beats? Caffeine can cause extra heartbeats. It lowers the threshold for ventricular fibrillation, and it's a common cause of sudden unexpected death. They don't allow it in the coronary care units for that very reason. So, looking at the stomach now, personal experience I had with a guy named Lacey. In the middle of the night, I was called to see this fellow who had his was bending over the examining table with his head on the table. I said, "What's the matter?" He said, "My stomach is on fire." I asked him, I've learned that caffeine can be a problem. I asked him how much coffee he drank. Nobody had ever told him that 2 pots a day might be a problem for his stomach. He had done all kinds of tests, x-rays, and so on, and they had not solved his problem. Coffee weakens the tone of the lower esophageal sphincter, allowing gastric reflux to be a factor. It's a bonanza, I should say, for the makers of Tagamet, Pepcid, Prevacid, all these purple pills and so on that make the antacids, because they want you to have plenty of acid so they can sell their product. What a fiasco that is. Fibrocystic disease of the breast is a factor. It tends to increase this. Caffeine is the most common cause of the disease and responsible for most breast surgeries. To biopsy it to find out if that lump is really a cancer or if it's just a fibrous tumor. Caffeine is also a risk factor for breast cancer due to its effect on the p53 suppressor gene. And cancer of the pancreas is a definite problem. Coffee use may account for a substantial proportion of those who get this disease. It was reported over 35 years ago in the New England Journal. It's been so long ago that people have forgotten and they think coffee is fine. Caffeine's tumor role may be due to its opposing action to melatonin. Melatonin has many beneficial effects, including sleep induction and immune system activation, both of which are opposed by caffeine. It can help jet lag. When something is good for the body, like exercise, it has many effects. Exercise helps blood pressure, appetite, sleep, attitudes, elimination. But when something is bad for the body, like caffeine, it has many bad effects, and we've been looking at some of them. And so we might wonder, how does headache, wakefulness, palpitation, heart, indigestion, trembling, and many of these others. This is the textbook that you got with this course. Hope you read it. The author was excellent in her insights. And these problems come from, all of the problems that we've been seeing here come from a drug that the FDA says is safe. It categorizes them as GRAS, generally recognized as safe. What a disaster. Headaches, nervousness, insomnia, indigestion, gastritis, ulcers, gastroesophageal reflux disease, increased blood pressure, irregularity of the heart, breast lumps, cleft palate, osteoporosis, cancer of the pancreas and bladder, elevated triglycerides and blood sugar, and as Pavlov said, bad habit glue. It glues all of our bad habits together. And the FDA takes millions from other companies and thanks them by recognizing it all as safe. Bad deal. Guess who I am? It is mighty hard to shake me. In my brawny arms I take thee. I can either make or break thee. I'm a habit. Choose me well when you are starting. Seldom is there easy parting. I'm a devil or a darling. I'm a habit. So let's consider the fact that the power of choice is the brain power. The brain has this power over its operation. And if you make the choice, it will figure out a way to do it. Please join us in making this pledge as an aid to better health and sounder sleep, calmer nerves, better blood pressure, heart regularity, lower cancer risk, and other serious problems. With God's help, I choose to abstain from caffeine in its many forms, coffee, tea, colas, or over-the-counter drugs. We can do this, and we can have better health. Let's do it. Caffeine is like Russian roulette. Who would want to put one bullet in a revolver and just spin it around, take one chance out of 6? Most people need their daily dose, or they'll get withdrawal symptoms if they try to quit. So let's look at that for just a minute. Quitting begins in the evening. Take a 20-minute walk after supper, and then enjoy a warm but not real hot bath, and take some melatonin if you have trouble sleeping. Consider exercise when you get up in the morning early. Take a warm even hot shower, but finish with a brief burst of cold. A hot and cold shower will double your white blood count. It helps your resistance to colds and flu. It stimulates your stress response so that you will have a lift but without a letdown that the coffee will give you. We can break the habit if we're willing to face withdrawal. Headache is common and can be severe. Use an aspirin or a Tylenol or an Advil or something if you have to. I'm not pushing drugs, but these are over the counter. And if it can get away from caffeine, you're better off if you have to do that. Most other analgesics will have caffeine. Do not use Excedrin, Anacin, Purinol as a prescription item, but it has, Caprigot is for migraine, but it has caffeine in it, as you can see. And so don't, APC or Goody powder is not good, just as a news report. So give it your best shot. Thank you for considering us. We look forward to seeing you again. Thank you.